Take a moment and picture this with me. You're waiting in a beige exam room. It smells faintly of alcohol gel. On one wall, there's an outdated COVID poster. On the other, there's the mammogram schedule that you may or may not need. You have your notes. You've been preparing for this appointment with a new provider for days. On the other side of the wall is someone who's new to you. If you're lucky, they're looking through your chart, seeing who you've seen lately, looking at past laboratories. They're gathering some history on you so that when they walk through that door, they're clued in. I'm Rebecca. I was a primary care provider and a GP for 10 years. Now I've left primary care to just do POTS, MCAS, and hypermobile EDS because 15 years ago, I was completely lost and there was no one for me. So instead, I became the person that I needed. My mission is to train and build a network of PCPs who can operate to do all the things that are not your birth control and your thyroid medication so that you can have a home base for your complex chronic invisible illnesses. The caveat to my talk is when I say providers, physicians, I'm not talking about the people who are here, the providers who are listening. I'm talking about the ones who don't know so much about what all of us have been talking about for this important week. So I love stories and stories, for all of you neurodivergent folks. And the way in which we speak and you have the analogies for the way your pain feels, I feel like that is the most valuable thing you can give your care team, but stories and stories are also really tough in a 12-minute office visit. So the standard healthcare system doesn't really know what to do to treat your issues effectively. You go into medical professionals looking for insight, for guidance. They tell you you're stressed out, you're probably anxious. Well, you are. You're anxious about your health. They say you might be depressed. They recommend physical therapy, lose weight, drink more water, salt your food. You can never salt your food enough. Then they tell you to salt your Gatorade. You know this stuff is probably not going to work, and you've tried all of it, or at least some of it. And one of your superpowers is you are remarkably persistent. You are resilient. For most of the people I see are incredibly intelligent. When someone tells you no, you recuperate for a bit, and then you look into other options that don't require relying upon the medical system. To me, setbacks happen when you get really, really excited about something. You dig into all of the literature. You've probably spent 48 hours reading things online, hopefully not from your bed, and then it doesn't work. And you had everything riding on this. So this was going to get your pain down 20%. Just like Dr. Bluestein said, 5 to 10. That's more of our standard. Or your body decides to do something weird and you can't pinpoint where it's coming from because you've learned over time that you weren't supposed to trust your body and you're trying to regain trust in it. Also, others are never as invested in your health as you are. I feel like often we go Mach speed towards something that we think is going to work and then we face plant. Whether face planting is a Potsy episode or face planting is being in bed, unable to get up for a few days, or hours ideally. Here's what you need to know, that really the superpower and setback is the opposite sides of the same coin. The important thing with this superpower is to know when you should deep dive and when you should take a break and walk away. When you've not found the knowledge and resources you need in the system, that's when we start thinking about alternative options. I think this is how many providers here, their patients found them. So you found someone on YouTube, you followed it, you found where they worked, you got on their 6-month to 2-year waiting list, and then you knew that they would connect you to more resources. I screen every person that I see for where their top resources are. I often hear the EDS Society website. I hear certain people on TikTok. I hear Dr. Maxwell out of Canada for the EDS Foundation there. Many people will tell me they found a PT and they learned a new taping technique from YouTube because the one that they were doing in person wasn't working. And they also found a tape that doesn't give them hives. And that's beautiful. Many people have said that they would be on TikTok looking at panda bears and puppy dogs, and slowly over time, it turned into hypermobility. And they would say, oh, I can do all those things. It would turn into people fainting. Go, oh my gosh, that sounds like my daily life. And it ends up that they arrive at some combination of hypermobile EDS, POTS, and MCAS off of TikTok or Instagram. That's not where we want to be finding our medical information, but it does give us a jump start. I'd say in my practice, about 95% of the people are neurodivergent. Around 50% are somewhere on the spectrum, whether it's formal or not. In the fast-paced medical system, which I believe is everywhere, it can't be just the US. I heard today at lunch that the regular GP visit in the UK is 10 minutes. In the US, it's about 12, but that's still 20% more. It doesn't work when you have complex illnesses because they're trying to put you in cute little boxes, and these are not box type of problems. There are no free text areas. We need that. So one of your superpowers is that you're probably neurodivergent. Some of us are just newly coming into recognizing it, but that it gives you this amazing ability to hyper-focus, like I know we're talking about later on today and we talked about yesterday. So when you find something that you think could be your thing, you're really good at diving into it. You see the interconnectedness of your symptoms often, and more often than your team does. A big setback to me is literally getting into clinic, which is why the pandemic enabled a lot of benefits for neurodivergent people, because getting into clinic is exhausting. You have to get up. You have to talk to the front desk. You have to make it past the medical assistant to arrive in this beige room with the really overwhelming lights and all the smells and all of the touching. Then you have to fit your whole story into just a few minutes. There was even a 2021 study I found where it shows that of the neurodivergent folks, often with tic disorders, that they're 100% more hypermobile than the general population. So neurodivergent folks are nuanced, with the stories and stories, with the wonderful analogies of describing pain, like a thorn exploded in my throat, or like a ball exploded with thorns on it in my throat. So I know exactly what you're talking about now. It's not this ache, there's a little stab. And that's how you describe eosinophilic esophagitis, apparently. So let's step back to evaluate how you can begin to assess your superpowers. You want to be limitless. I understand that feeling limitless and even the idea of it with having POTS, MCAS, or hypermobile EDS ++, all of the extra things you can possibly have, can feel impossible a lot of the days, but you deserve to feel unlimited by these. There's so much focus on what's wrong with your life, and I think we often hyper-focus on what thing am I going to fix next, that it's important to recognize the things that give you joy that you do have in your everyday life and that you are in control of. I have a mantra. It's called, everything is always working out for me. And I got a new client lately, and they were so stuck in the spin cycle. And I said, just humor me and just say this all day long. And it's just, you get the stink eye, and you're like, really? I just have to say this thing? I said, yeah, just humor me. And she did it all day long for weeks, to the point where when she finally made it in for her MCAS labs, the lab techs are bickering over which tubes have to be chilled, and if she should lie on the floor to have them done. And are they really going to put them in the fridge right away? And as someone who's prone to panic attacks and is multiply neurodivergent, she said, and I just sat there laughing, thinking everything's always gonna work out for me. They'll figure their stuff out because this is not my problem anymore. I'm just gonna watch them put it in the fridge. They refused to watch her let them put it in the fridge. She just had to trust them. I feel like even with a mantra like that, you begin to regain the self-trust that's been eroded for some people from the time they were 8 to 12 years old, when things initially started happening. And that you begin to learn to forgive your body for what it can't do. Now, the setback factor is that you can get stuck in a spin cycle, and the physical can set off the mental, and then the mental can set off the physical, and then you're not really sure where to go next. And then we beat ourselves up over our limitations. I know we talked about earlier, like with Dr. Belvey, calculating like, what can I do? So am I going to go to this party later on? What can I do that will enable being able to do that? And the years of self-trust lost because you were told that you were wrong. Whether it was from your folks, it was from family members, because everyone in our family can do that. We can all bend our thumb down and touch our arm. We can all put our hands flat on the ground. That's not weird. We all get hip replacements by 55. That's just what our family does. Another factor is, what if what brings you joy also causes you pain and sets things off? I have a client who owns a dance studio, and she's been dancing since she was 4. And she had the same conversation with at least 3 orthos who said, dancing is making you worse. Dancing is why you've probably torn your labrums. It's why your shoulders and your neck aren't great. And she said, but dancing is who I am. And eventually it came down to, you will always be a dancer, you will own this studio, but how can we tailor it so that it hurts you less? Can we take more breaks? Can we fit in a real lunch break? Because what gives her joy is more important than getting rid of everything just to make the EDS and POTS better. Also, we've touched on briefly throughout the conference in terms of neuroplasticity. So how can we start to grow new connections in our brains so that we can refocus on the positive aspects of our life? I'm not talking toxic positivity. I'm not thinking yourself into health. We're talking about changing the way your brain works and something you are entirely in control of. So recently I saw someone who's also a healthcare worker who's looking into EDS, and we're pretty certain that's what she has. And I gave her 7 things to do because we have long new client appointments. And she said, of all those things you gave me, we tried multiple supplements and medications and seeing PT and a referral. She said, those 3 mindfulnesses that you picked out for my morning and my night, those made the biggest difference. And I'm still really surprised over it because I've been in healthcare for 10 years and no one's ever suggested that. So I just told her, I like this one app. Here are 3 I like for the morning. Here are 3 I like for the night, because you start out frazzled. Like, you sound stressed out every morning. You get to clinic and you're running for 12 hours. So set your alarm 10 minutes early, press play. And that's all she did. And she realized that the mornings were easier, her heart rate was more stable, and when she went to bed at night, instead of tossing and turning, she fell asleep so fast she didn't even put her CPAP on. She said it was less than 90 seconds. And there's no side effect to mindfulness. It's always good because I feel as if so many of us are so prone to the issues of side effects. It also helps with the overthinking at bedtime, where you get stuck in the spin because you had a great idea, so you just looked a little bit online, but it led to another great idea, and now you're realizing that you can solve your problems if you do just a little bit more work. Maybe you'll write it down, maybe you'll send a few links to your friends. We've all been there. It's a great idea at 2 a.m. From a place of more positive focus, where you're growing your new neuronal connections, your research is going to be more productive. Your mindset will be in a place where your muscles can start to relax and vice versa. In deep sleep, which is stage 3, your brain gets washed out with cerebral spinal fluid. I don't know who all has seen the videos, but they are stunning. They do it under CT, and you can watch the waves going through you. And we know what a loaded topic sleep is when it comes to complex chronic illness, but that it does restore your body. It reduces the inflammation, it promotes muscle relaxation, and it starts to restore your equilibrium. Maybe CSF is like the body braid for our brain and our system, the reset overnight. Even in this complex chronic invisible illness, our brains are capable of a lot more than just deep diving the internet. And always, as we've talked about before in this conference, you're always your best advocate. Ultimately, you want to find the root cause of what's going on with your health mysteries, whether it's one specific root cause or the overlapping trifecta pentad or the truly expansive pentad. I always want to know what sets off the other ones. So someone will come in and say, it's just my shoulder, it must be hypermobile EDS. But what if they're so inflamed all the time because they have certain dietary intolerances that they're fueling their system with? You will need a team to do this, however. So that person on the other side of the door who's briefly looked through your chart, we need to get them somewhat invested. Because you always hear, we can't find anything until you're way deep into it. Your labs are still normal, that x-ray is normal. And we know how expensive MRIs are, and trying to get a provider to order a head-to-toe MRI, I don't know if it's ever been done, short of the emergency room. But you are uncommon, which merits fancy tests. If you have a good relationship with your PCP or GP, they will often go above and beyond and start to give you the tests that you know you deserve. But it feels iffy for us in the beginning because we don't always know what to do with them. And they're nuanced tests, such as the ones for POTS and MCAS, the ones where you're supposed to make yourself feel bad and be in a flare to have them done, to lay on the ground. It's always weird when you have to lay on the ground in a lab, but there are blood and bodily fluids, in order to get some validation. It's okay to be uncomfortable with leaning into the discomfort, because speaking to a provider in a setting, it's loaded. They have lots of years of training, but you always know your body best, and that you often have to speak up and not be the person you've typically been. I found that telemedicine has been amazing for this because it gets rid of a lot of the dynamic and it allows the neurodivergent folks to speak up, to not have to worry about masking in public. It's tiring advocating for yourself. So if you have someone you can bring with you, that's always recommended. If you just say, today's a rough day, I need some help. And then there's always your care team moving on and retiring. I have some people in their 60s where over the pandemic, they lost half their care team, and the replacements are leaving in less than 2 years. So it's just getting used to new people over and over again can be a big setback when you're trying to activate your superpowers. I wrote a guide for some patients because I had so many people whose PCPs and GPs moved in the pandemic and they had to go around interviewing new people. And they'd say, I met someone new again and they just shut down immediately. Or they accessed my chart because in the US, a lot of places use Epic or MyChart. So it's open communication, you can see everything. And they said, they literally said I'm too intense for them. Like they don't have the panel or they don't have the time. So I made a guide where you fit your whole life in an 8x10. And I said, just do this because I think you're overwhelming us. We just need to get in for the thing that we need their help with when we have other team members already in place. And she told me about how she'd been trying to pack her whole life story in because she was so desperate to feel better. And she realized after that that she was overwhelming them and that she'd walked out of multiple visits just feeling so dejected. And nowadays she meets new providers and sees it as more of an interviewing process. Like, she'll say, like, do you have enough emotional energy for me? Like, are you caring for an aging parent? Do you have a 6-month-old baby? Do you have a panel that is so full, I couldn't get a visit for 3 months because then we could not possibly be a good fit? Do you like investigating unusual things, or are you just weight loss, diabetes, high blood pressure? Because those are not my problems. All of us deserve to be seen and heard and validated, and it's hard to get that in mainstream medicine. Ultimately, you're always your best advocate. You really need a high-level plan of what you can dig into. So oftentimes, with my complicated people, when we're stuck and we're saying, we thought this was the best idea ever and it just didn't work out, we go back to basics, where it's almost a new patient intake all over again. So we're saying, let's scrap everything we remember, write down all of your symptoms, pick one body part, start with your head, work down to your toe or toes up, and let's see what feels doable, because we need some easy wins here to get back into it, because this is all too overwhelming right now. Sometimes we'll start with GI, which feels really iffy because, hello, MCAS. But to say, what little things did we miss? Did we miss step 1? Did we miss step 2? Did we miss just doing some basic famotidine and trying out some better allergy medications? Think about negative experiences during normal activities that seem normal to you because they're common in your family. So if you can trace it back and say, in my parent who I think I got these issues from, this is how it's looking for them now, this is where they've gotten, and then apply that lens to your life. This is ways in which deep diving is a good idea because it gets us more data on your body and on your history. If you want to go down the rabbit hole of 2 a.m. internet research, or all day, if that's more of your professional patient profession, let's do it deliberately based on suspicion of what we think is going on. Do it from an MCAS lens, from a hypermobile EDS lens, from a POTC lens. We are really good at the internet. I feel like most people in this room are of outstanding intelligence. You have been doing the work for years, and often you've been told you're wrong, and that's probably a lot of the reason why a lot of the patients are here. To be in a place where you're in camaraderie, where other patients and providers know what you're talking about and don't think it's weird at all. In our shared symptoms and insight, we gain insight, just being the investigation, the diagnosis, and the camaraderie of all of it. So let's use our superpower of hyper-focusing to start gathering, to start brain dumping out that information, and to narrow our focus. Because your superpowers are greater than the current setbacks and those that will come later. You deserve to know the root of what's going on with your complex chronic issues, and there's likely going to be more than one. We can attack the potentials by gathering information, dividing it, and categorizing it. You do need a system. Don't try to create your system overnight, but especially meeting new people, it's nice to have it ready-made for you. You don't have to reinvent the wheel every time. And most of the people I see, 10% of them have already done that. Let's root yourself in a minimal effort activity, like mindfulness, something where you can just press play and have someone else talk to you. Because it's going to enable more neuroplasticity that will magnify your superpowers and calm your nervous system. Like, it's been a full few days of just connecting with people who understand your struggles and complexity. Lots of ahas and validation. You've stood and you've sat, you've moved more than usual. You could be low on spoons. It's bright and busy out there. It's less bright in here. But it's all pretty exhausting. So I challenge you that when you leave here to find a guided meditation or take a walk in the beautiful park across the street with the orchard, to calm down the excitement so that you won't be spinning overnight. It won't carry over into tachycardia. It's going to enable deeper sleep and the accompanying muscle relaxation. So why is thinking about your superpowers and their associated setbacks worth it? Why do the complicated patients keep going? Because we know our bodies best, always. We're regaining trust in our ability to read our own bodies, and we deserve to be limitless in our potential to have joy and participate in our own lives. Thank you.